Welcome back, everybody, for another deep dive. This time, we're tackling something really important, mental health challenges. You guys sent in some super interesting stuff. Pasted text was the name, right? And I gotta say, one thing that jumped out at me was how these challenges, well, they aren't always just, in your head. They can actually show up physically, too.
Oh, yeah, definitely.
Yeah.
That's what makes understanding all the different signs and symptoms so important. It's not always the stuff we think of, like the classic, emotional distress.
So the source we got goes right into identifying those signs. It says we got to watch out for emotional stuff, behavioral things, and even physical signs. But it's not like a checklist you can just tick off, is it?
Right. It's way more nuanced than that. I mean, what might be a huge red flag for one person could be totally normal for somebody else. It's all about noticing changes, like from your own baseline or in someone you know really well.
Yeah, that makes sense. It's about knowing what's typical for you and what's out of the ordinary for that person.
Exactly. And then, there's another big hurdle we got to talk about, the stigma around mental health.
Yeah.
It's real, and it can make people hesitate, to reach out for help because they're worried about judgment and stuff like that.
Which is honestly such a shame because getting help is it can be so powerful.
Totally agree. It's a huge step towards taking charge of your own well-being.
Now, the source gets into causes, and I love this. They compare it to a puzzle, with all these different pieces, and it really shows how complex those causes can be. We're talking biology, psychology, even things in your environment. What really stands out for you when we start, putting those puzzle pieces together?
Well, let's start with the biology side. The source mentions genetics, like family history. If you have a family history of mental health stuff, well, it can make you more, susceptible.
So it's not always about, willpower or just snapping out of it, like some people might say.
Exactly. And then there's brain chemistry, too. Imbalances in those neurotransmitters, things like serotonin, which helps regulate mood. They can lead to things like depression. Think of it like a dance in the brain, but the chemicals are offbeat.
Oh, I like that. And then we've got chronic illness, too. That adds, a whole other layer.
Right. If you're managing a long-term health condition, it can really affect your mental well-being. It's an extra weight.
It's wild how all these physical things can be connected to those physical symptoms we were talking about before. It's like, wow, our mind and body, they're really connected.
No doubt.
Yeah.
Okay, let's move to that psychology piece of the puzzle. The source talks about trauma, things like abuse or if you've lost someone important. Those can leave a mark for sure.
Trauma, yeah, definitely. But then there's also how we think. Our thought patterns can really help or hurt us.
Right. And the source talks about negative thinking as a big contributor. Like when people catastrophize, always imagining the worst. It can fuel anxiety and make it hard to see things clearly.
It's like we create our own problems in our heads,
Our minds are powerful. And last but not least, the environment piece. The stuff around us that can impact our well-being.
The source talks about stressful events, job loss, relationships ending, stuff like that. Things that, well, most of us go through at some point, right?
It's part of life.
Yeah.
But it's how we handle those stressors. And then there's social isolation. That's a big one these days. That lack of connection can really hurt.
Makes sense. We're social creatures, And the source also talks about those societal pressures, like always having to be successful, the comparisons we make. Exhausting.
Absolutely. So we've got this mix of biology, psychology, and all the stuff in our environment, all contributing to mental health. And it can feel overwhelming, but here's the good news. The source doesn't just leave us with all these problems. It talks about solutions, too.
I like how they call it a toolkit, stuff we can use. It feels hopeful.
Totally.
Yeah.
And a lot of people start with professional help, which is a great first step.
For sure. There are all kinds of therapy out there. One that pops up a lot is CBT, cognitive behavioral therapy.
Oh, CBT is fascinating. It's all about the link between what you think, how you feel, and what you do. Imagine thinking, I'm a failure all the time. CBT helps you see that pattern and then gives you tools to change it into something more balanced, more realistic.
So it's like rewiring your brain, kind of. And then there's medication, too. That can be part of the answer for some people, right? The source mentions antidepressants, anti-anxiety meds, things like that.
Yeah, medication can be super helpful. But it's not like a magic bullet for everyone. It's all about finding the right approach for each person. And a lot of times that means therapy, meds, ND lifestyle changes altogether. The important thing is having access to those options and feeling comfortable asking for help.
But some people might not even realize they need help,
Yeah.
The source talks about regular mental health checkups, which I think is interesting.
I love that idea.
Yeah.
We get physicals every year, so why not for our mental health too? Catching things early can make a huge difference.
It's being proactive, just like with our physical health.
Exactly. And professional help is just one piece of the puzzle. The source also talks about support systems, which are so crucial.
That feeling of connection, right?
It's huge. Family, friends, they can give you that emotional support and combat that isolation we talked about. Just talking openly can be so healing.
It's not just about getting support, though. It's about giving it, too. Being there for someone who's struggling, that matters, too.
100%. And there are support groups, too, where people connect with others going through the same stuff. That shared experience is really powerful.
It's like you're not alone in this. The source also mentions those community resources, which can be super helpful.
Yeah, tons of nonprofits and local organizations offer mental health services, sometimes even for free. This is so important for making sure everyone can access care, even if they don't have insurance or money for private therapy.
That's so important. So we've got professional help, support systems. What else is in this toolkit? What else can people do?
Well, there's the proactive approach, those healthy habits, things you can do on your own to boost your well-being.
The source talks about getting active, a good diet, and good sleep. It's like a recipe for a healthy mind.
Love that analogy.
Yeah.
So let's start with exercise. Aerobic stuff, especially, it pumps up those endorphins, which are natural mood boosters. Even a quick walk can help.
It's amazing how our physical state affects how we feel mentally.
It's all connected. And then there's food. A balanced diet gives your brain what it needs to function, like brain fuel.
And lastly, sleep. We all know how cranky we get when we don't sleep enough. But it's more than just mood, right?
So much more. Sleep is crucial for how our brains work. Processing info, handling emotions, making good decisions. It's like hitting reset each night.
Okay, so we've got professional help, support, healthy habits. But there's one more big thing the source talks about.
You're talking about tackling that stigma, right?
Exactly. We mentioned it before, but it's such a big problem. Stigma stops people from getting help and keeps those harmful stereotypes alive. So how do we even start to deal with that?
The source says education is key. The more we understand about mental health, the better we can challenge those misconceptions. Replace fear with knowledge.
And I bet personal stories play a role, too. The source talks about advocacy.
100%. Sharing your story when it's safe to do so can really normalize things, shows others they're not alone. It makes these challenges more human.
It's about being open and understanding, creating that kind of culture.
Yep. And that goes for work, too. The source talks about workplaces promoting mental well-being, which is so important.
Makes sense. We spend so much time at work.
Right. Think about encouraging mental health days, making it okay to talk about struggles, having resources like employee assistance programs. It's about feeling valued at work as a whole person.
So to combat stigma, it's education, sharing stories, and changes at work. Sounds like it takes everyone working together.
Absolutely. It's about people, communities, institutions, all working towards a mentally healthier world.
It's like, we got to change the whole conversation about mental health, right?
Totally. And that brings us back to each person. What can you do to prioritize your own mental health and create a more supportive environment?
The source has some really good tips. Things like building resilience, bouncing back from tough times.
Resilience is like a muscle you can train. And it's not about avoiding problems. It's about having healthy ways to cope with them, as the source points out.
So instead of unhealthy habits when things get tough, what are some healthier options?
Lots of them. Exercise is a classic. Releases those endorphins, the feel-good stuff. Being in nature is great too, very calming. Music, spending time with loved ones. There's so many things. You just got to find what works for you and make it a habit.
So it's about having those go-to things when you need them.
Exactly. And the source also talks about mindfulness, being present in the moment, without judging yourself.
Easier said than done in this crazy world, right?
I hear you. It can be tough. But even just a few minutes a day can help. Things like meditation, deep breathing, they can really bring you back to the present. You can even try being mindful during everyday stuff.
Oh, how would that work?
So imagine you're eating, right? Instead of scrolling on your phone, really pay attention to the food, taste it, feel the texture, slow down, be in that moment.
It's like hitting pause on autopilot.
Exactly. And that ability to just pause, observe, instead of reacting, that's super helpful for stress and those tough emotions.
Makes sense. And speaking of managing ourselves, the source talks about boundaries.
Boundaries are like your protectors, They protect your time, energy, your well-being. It's learning to say no, even when it's hard, and putting your needs first, even when it feels, selfish.
That's hard, especially for people pleasers like me.
It is tough. But remember, setting boundaries isn't selfish. It's about self-respect. You're communicating what you need, what you won't accept, but in a calm way, And it's not just about setting them, it's about keeping them too.
So like holding firm when someone tries to push past them.
You got it. And it's a process. It takes practice. It might be awkward at first, but it gets easier.
The source really emphasizes that, like it's a journey, this whole resilience thing.
It is. It's a lifelong thing, learning and adapting. But the cool thing is, resilience isn't just about you being strong. It's also about knowing when to get support from others.
We don't have to go through it alone.
Exactly. And sometimes that means reaching out to a professional.
Right. The source mentions therapists, counselors, all those folks. They can really help us through tough stuff.
They can, and they're trained for it. They can help us understand ourselves better, our thoughts, feelings, behaviors, and they can teach us how to cope with stress, anxiety, all that. Plus, it's a safe space to talk, work through things.
And it's so important to remember, asking for help that's not weak, it shows strength and that you're self-aware.
Could not agree more. And you don't have to be in crisis to reach out. Taking care of your mental health, making it a priority, that's powerful. As we go through all these solutions, something that really stands out from the source is that mind-body connection. We tend to think of mental and physical health as like separate things, but they're totally intertwined.
Yeah, it's like that whole healthy body, healthy mind thing, but like way deeper.
Right. Think about it. Stress can show up physically, headaches, tense muscles, even stomach problems. Your body's trying to tell you something's up.
Like it's sending you a message.
Totally. And the opposite is true too. Chronic pain, long-term illness, those can really mess with your mental well-being. It goes both ways. That's why we need to think about health holistically.
It's not just about treating like the symptoms, but seeing the whole picture, the whole person.
Absolutely. And sometimes that means looking beyond just individual stuff and thinking about how society impacts mental health too.
The source mentioned that, right? That pressure to be successful, the stigma around getting help, not having access to affordable care. Those are bigger issues, systems issues.
For sure. And they create an environment where, well, it's harder to be mentally healthy.
Yeah.
It's like we need a whole system overhaul for mental health, addressing those big picture things alongside individual needs.
So we can't change the whole system overnight. But what can we do on a personal level to take care of our own well-being and help create a better environment for everyone?
Well, the source talks about resilience, that ability to bounce back when things get rough.
It's like inner strength, right?
Yeah.
But are we born with it, or can we actually build it up?
That's the good news. Resilience is something we can develop. And the source says one of the best ways is to learn healthy coping mechanisms. So instead of doing unhealthy stuff when stress hits, we find positive ways to deal with it.
So instead of that extra glass of wine or shutting everyone out, you have healthier options ready to go.
Exactly. Exercise is a classic example. Releases endorphins, those mood boosters. Being in nature helps too. It's calming. There's music, talking to loved ones, so many options. The key is to find what works for you and make it a habit.
It's like building a toolbox full of strategies for when you need them.
Exactly. And the source also talks about mindfulness, being present in the moment, without judging your thoughts and feelings.
That's way harder than it sounds, especially with how busy life is these days.
It is tough. But even just a few minutes each day makes a difference. Try things like meditation or deep breathing. It helps you focus on the now. You can even practice mindfulness in your everyday life.
Oh, like how?
Okay, imagine you're eating dinner. Instead of being on your phone, pay attention to the food, how it tastes, how it feels in your mouth. Just slow down, experience that moment fully.
It's like being present instead of on autopilot, right?
Right. And learning to pause, to observe your thoughts and feelings instead of immediately reacting. That's so helpful when you're stressed or dealing with difficult emotions.
That makes a lot of sense. And the source also talks about something else we need to manage: setting boundaries.
Boundaries are essential. They protect your time, your energy, your well-being. It's all about learning to say no, even when you don't want to, and putting your own needs first, even when it feels, like you're being selfish.
That's so hard for a people pleaser.
I know, it's tough. But remember, setting boundaries, that's not selfish, it's self-respect. It's about being clear about your limits, what you will and won't accept. And the key is, you got to enforce those boundaries too.
So you have to stand your ground when someone tries to, push those boundaries.
You got it. It's a process, takes practice. It might feel weird at first, but it gets easier, trust me.
The source was big on that point, too. It's an ongoing thing, this resilience and boundary stuff.
Totally. It's all about learning as you go.
Yeah.
And something to remember. Resilience isn't always about being tough on your own. It's also about knowing when to ask for help.
Knowing you don't have to go through it all alone.
Right. And sometimes that means reaching out for professional help.
Yeah. Therapists, counselors, all those folks, they can give us tools to deal with all this stuff.
They can. They're trained to help us understand our thoughts, our feelings, how we behave. And they teach us coping skills for stress, anxiety, all of it. Plus, therapy is a safe space to talk, to process things.
And remember, asking for help, that's not a sign of weakness. It actually takes a lot of strength and self-awareness to do that.
Couldn't agree more. You don't have to wait until things are really bad to reach out for help. You know, being proactive about your mental health, prioritizing it, that's what matters.
Totally. And the source mentions another source of support, the community.
Oh, community support is huge. It's about connecting with people who get AIT.
Yeah.
Support groups, online forums, even just talking to friends and family who understand what you're going through.
Just knowing you're not alone in your struggles, that can be so powerful and healing.
It can. And community support isn't just about venting. It's also about celebrating the good things, the little wins. It's about being around people who make you feel good.
It's about nurturing those connections that make you feel like you belong.
Exactly. And even if you're struggling yourself, you can still be there for someone else. Just listening, being a shoulder to cry on, letting them know they're not alone. Those things make a difference.
It's about that sense of we're all in this together, stronger together.
One thing from the source that really hit home for me was the part about self-compassion. Treating yourself with the same kindness you'd show a friend.
Oof, that's a hard one. We tend to be so much harder on ourselves.
It's true. We're constantly told to be perfect, and then when we're not, which is like always, we beat ourselves up about it. But self-compassion isn't about ignoring your flaws or letting yourself off easy. It's about accepting those imperfections with, like, kindness and grace.
So it's like changing that voice in your head from being super critical to being more understanding and encouraging.
Yeah, exactly. It's about realizing we're all just doing the best we can, flaws and all. And the source has some good tips for this. One is talk to yourself like you'd talk to a friend. Be supportive. Be kind.
That's a good one. We're way nicer to other people than we are to ourselves.
Isn't that the truth? The source also says to remember, we all mess up sometimes. We all have flaws. We all struggle. Remembering that helps us feel less alone.
It's like it normalizes the struggles, right? Makes you feel less ashamed.
Exactly. And the source suggests mindfulness can help with self-compassion too. When you're mindful, you're more aware of your thoughts and feelings, so you're less likely to get trapped in those negative self-talk loops.
It's about bringing that awareness to what's going on inside you without judging yourself.
Exactly. But remember, this self-compassion thing, it's a skill. It takes practice. Might feel weird at first, but it gets easier.
It's like building up that kindness muscle.
That's it. And the more self-compassion you have, the happier you'll be, and the more resilient you'll become. It's pretty amazing, honestly.
It's a good reminder that we all deserve kindness, especially from ourselves. And speaking of treating ourselves well, the source talks about another important piece: setting boundaries.
Oh, boundaries are essential. They help us protect our time, our energy, our well-being. Think of them as the lines you draw to define what you will and will not accept from others.
It's about learning to say no, even when it's hard, and putting your needs first, even if it feels a little selfish.
Because if you don't have boundaries, you end up feeling resentful, overwhelmed, burnt out, and nobody wins in that situation.
Okay, so how do we even set boundaries? How do you do that in a way that feels good and empowering, not like you're being mean?
Well, the source has some great tips. First, figure out your values and what's most important to you. Your boundaries should reflect that.
So if spending time with family is super important to you, setting boundaries around your work hours could be a good place to start.
Exactly. Then, it's about communicating those boundaries clearly and confidently, saying what you need, what you won't put up with, but in a calm, respectful way.
Ugh, that can be so hard, especially if you're someone who likes to make everyone happy.
I get it, it can be tough. But remember, setting boundaries isn't about being selfish. It's about taking care of yourself and having self-respect. It's about honoring your needs and what you can handle. And it's not enough to just set boundaries. You got to enforce them too.
So that means being firm when someone tries to, cross those lines you've set up?
You got it. Hold strong to those boundaries. And setting boundaries is not a one-time thing. It's something you got to keep working on, keep adjusting as you go.
It's about learning and adapting as life changes, right? The source also talked about how mindfulness can actually help with setting and sticking to those
Oh
boundaries.
yeah, mindfulness can be a game changer for boundaries. When you're mindful, you're more tuned into yourself, your thoughts, feelings, even your body. You're more aware of your needs and limits, so you'll notice more quickly when someone is pushing those boundaries.
So it's about being aware in your interactions and noticing how you feel in those moments.
Yep, exactly. And mindfulness can also help you react in a more, I guess, skillful way when someone does cross a boundary. Instead of getting angry or frustrated, you can take a breath, pause, and respond in a way that aligns with your values and protects your well-being.
It's about balancing being assertive with having healthy relationships.
Exactly. And setting boundaries, it's not about being mean or selfish. It's about being self-aware and having self-respect. It's about building a life that feels good and balanced.
Okay, we've talked about a lot of proactive things you can do for your mental health, but the source is also very clear about something else, knowing when to get professional help.
There's zero shame in asking for help. Therapy and counseling can give you amazing support and tools to help you deal with mental health challenges.
It's realizing that sometimes you just need a little extra help to get through tough times.
And therapists, counselors, those folks, they're trained to do just that. They help us understand our thoughts, feelings, behaviors. They teach us how to cope with stress, anxiety, and depression.
Therapy's a safe space to just talk, to work through difficult emotions. And that can be incredibly healing.
It is. And it's so important to remember. Seeking help, it's not weak. In fact, it shows strength and self-awareness.
It's about taking charge of your well-being and being proactive.
Absolutely. And remember, there's no one-size-fits-all approach to therapy. There are lots of different types, each with a different style. Finding a therapist who clicks with you and who understands your specific challenges, that's key.
So do your research, try different things until you find what works for you.
Exactly. Find the support that meets your needs.
We've been talking a lot about individual stuff, but the source also highlights how important community support is for mental well-being.
Community is huge EE. It's about connecting with others who understand what you're going through. Support groups, online forums, even just talking to close friends and family.
That feeling of knowing you're not alone, that can be so powerful and healing, right?
Absolutely. And community isn't just about sharing the tough stuff. It's also about celebrating the good things, the little wins. It's about surrounding yourself with people who lift you up.
It's about those connections that make you feel supported and like you belong.
Yep. And even if you're going through a tough time yourself, you can still be there for someone else. Just listening, being there for them, reminding them they're not alone. Those things matter a lot.
It's all about creating that web of support, knowing that we're stronger together.
You know, one thing from the source that really resonated with me was the emphasis on self-compassion, treating yourself with the same kindness and understanding you'd offer a friend.
Ooh, that can be a hard one. We're often so much harder on ourselves than anyone else.
It's true. We're always pushing ourselves to be perfect, and then when we fall short, which is inevitable, by the way, we beat ourselves up about it. But self-compassion isn't about ignoring your flaws or giving yourself a free pass. It's about recognizing those imperfections and being kind to yourself anyway.
So it's about changing that voice in your head from being super critical to being more understanding, more gentle with yourself.
Exactly. It's about realizing that we're all just doing our best with all our imperfections and struggles. And the source actually has some good advice for this, like talk to yourself the way you would talk to a friend. Be supportive. Be kind.
That's a good point. We'd never talk to a friend the way we sometimes talk to ourselves.
Right. The source also says it helps to remember that everyone messes up sometimes. We all have flaws, we all struggle. Remembering that helps us feel less alone,
It makes those struggles feel normal, and it can help with that shame we sometimes feel.
Exactly. And the source also says mindfulness can help with self-compassion. When you're more mindful, you're more aware of your thoughts and feelings, so you're less likely to get caught up in that negative self-talk spiral.
So it's about being aware of what's happening inside you, but without judging yourself.
You got it. And remember, self-compassion, it's a skill. Like anything, it takes practice. Might feel weird at first, but it gets easier with time.
It's about strengthening that kindness muscle.
Exactly. And the more you practice self-compassion, the happier and more resilient you'll become. It's a beautiful thing.
It really is. It's like that permission to be kind to yourself.
Wow, we covered so much in this deep dive from, recognizing the signs of mental health challenges to figuring out what causes them to all those tools and solutions we talked about.
It's been a journey, that's for sure. And I think more than anything, the message is you're not alone. Mental health challenges, they're super common, and there's help out there.
One thing that stuck with me from the source is that mental health, it's not like a finish line you cross. It's an ongoing thing, you know. There will always be ups and downs.
So true. It's not about being perfectly mentally healthy all the time. It's about having those coping strategies, those good habits, and those people you can lean on when things get tough.
And knowing when to reach out for help. That's not a weakness. It's smart. It's taking care of yourself.
Exactly. And it's about creating a world where everyone feels safe doing that, asking for help when they need it. It's a pretty amazing goal, right? A world where mental health isn't something to be ashamed of, but just part of being human.
And that change starts with each of us.
Yeah.
Learning, talking about it, fighting for change.
Yeah.
That's how we build a more understanding and compassionate world.
So as we wrap up, here's a thought for you guys. What's one small thing you can do today to either prioritize your own mental health or to support mental health in your community?
It could be anything. Checking in on a friend, doing some mindfulness for a few minutes, even just looking up mental health resources in your area.
Every little bit helps. Well, that's it for this deep dive, everyone. Thanks for joining us. Until next time, keep learning, keep exploring, and keep taking care of yourselves and each other.